Good morning, everyone, and thank you for being here this morning. My name's Mike Podgorski. I'm the Vice President of Pharmacy Services at Rite-Aid and also the President of Pennsylvania Association of Chain Drug Stores. As a Pennsylvania pharmacist, it gives me great pleasure to be here with you all as we commemorate an important milestone in the practice of pharmacy in the Commonwealth that will keep our children healthy this flu season. I'd like to welcome everyone to our pharmacy, including a few special guests who were instrumental in the passage of this bill. Representative Cheryl Delozier, a strong advocate for our side. Representative Seth Grove, prime sponsor of the bill in the House. Representative Julie Harhart, chair of the Professional Licensure Committee, and Senator Tom McGarrigle, who was the prime sponsor in the Senate. We also have with us Dr. Lauren Robinson, Deputy Secretary for Health Promotion and Disease Prevention. Members of the Pennsylvania Pharmacists Association and Pennsylvania Association of Chain Drug Stores. And last but not least, Rite-Aid associates from across the state. We've got a brief program for you this morning, and with that, I'd like to turn the microphone over to Representative Delozier.
Thank you, Mike, and thank you to Rite-Aid for hosting us today. Rite-Aid is one great example of the ability for what this new law will allow us to do. As we mentioned earlier, and Seth is going to go through the bill as the prime sponsor, but House Bill 182 was signed by the governor, and what the exciting part of it is the allowing for us to be more convenient and more keeping our folks healthy. What we want at all levels of our health system is to keep people healthy. That's the goal. That's what we want to do, whether it's in the hospitals, whether it's in our doctor's offices, or whether it's here in a pharmacy. The pharmacists work hard to make sure that those that they are serving get what they need, and one of those things that they need is a flu shot. The ability for our pharmacists to be able to administer these shots, and it is allows us to be convenient, allows us to be accessible, allows us to keep people healthier. I'm coming from the perspective of when I read this bill, it was something that I thought we needed primarily because as a parent of two children running around between practices, running around with school, running around with everything that we need to do, we do have to have those physicals at our doctor's offices, and I'm very lucky I have a great doctor who works with us and fits us in as soon as we possibly can. But sometimes that's just not doable when we need a flu shot and we need to go in and get an immunization from a pharmacist. So the ability, there's a Rite-Aid on every corner. We can go in, we can ask the pharmacist for assistance, we can bring our kids in, get a flu shot, we're in and out in 10 minutes. That's just something for convenience that we need for our families. Our goal, again, the bottom line of this bill was to keep people healthy. How do we keep people healthy? We give them good access to good health care. How do we give them good access? Is we have the convenience of the ability for us to get immunized, to make sure our kids are immunized. As the sign says above us, flu, it goes around and everybody comes down with it. We seem to share it like, a good hello, which we don't want to do, obviously. We want to be friendly with people, but we certainly don't want to share a cold. Having an immunization and keeping ourselves have that one more barrier to make sure that we're not going to get sick and share it with somebody else, that's a good thing. It goes around our schools like wildfire. When one kid gets sick, they all go down. We need to make sure that our kids are safe. We need to make sure that they're healthy, and this is one good step to be able to do it because now from the age of 9 and above, we can now go to our local Rite-Aids and pharmacies and have them give a flu shot. So I want to thank the Rite-Aids and all of the pharmacies that we have in our communities because without them, we wouldn't have this access. They've advocated. We've worked with many groups like the Medical Society, many of the medical groups in our communities that have supported this, and I thank them for their input because without their input, to say how can we do this the best way, we wouldn't be able to have been successful. So with that, I'm going to hand it off to Seth, and he's going to go down the ideas of the bill.
Thank you, Cheryl. First, I'd like to thank Rite-Aid for hosting this event today. I'd like to personally thank the administration, Dr. Rachel Levine, Deputy Secretary, thank you for joining us, and Governor Wolf for signing this very important law. bill into law. And huge thank you to Chairwoman Julie Harhart. I don't know how many meetings we had on this issue, but through her stewardship and leadership as the chairman of the committee this bill was in, it would not have gotten done without her. And also Senator Tom McGarrigle, who also did the companion bill over the Senate, and obviously Senate leadership for moving it on to the governor's desk. It's a real simple concept. If you want to increase immunizations in adolescents, there's two ways to do it. You can increase access, or you can do more mandates on parents to immunize their kids. We opted to do increase through access. By allowing pharmacists to immunize children, the original bill started at birth, all the way up to 18 through negotiation. We got it through 9 years and older. It opened up over 2,000 access points across the Commonwealth where parents can take their kids in and get flu immunization. Some pharmacies are open 24 hours a day. So depending on when you work, when it's most convenient for the parents, you have access through a much larger spectrum of hours to get your kids immunized. It's important. School is starting up, so it's important to get your kids immunized. We have certain laws on what different immunizations for what grade level, but it's critical that we get our kids immunized, protect them from flu outbreaks, and obviously we don't want them missing school, so it's a great opportunity for them to not get a flu and not miss extended time during the process. Again, Act 8 would allow pharmacists to immunize children 9 and older. It would also allow pharmacy interns to administer the flu shot. Those regulations are still being worked on, but effective yesterday, every pharmacist across the Commonwealth can now immunize children 9 and older. This is a huge step to increase our immunization rates and make Pennsylvania much healthier moving forward. I appreciate all the work that pharmacists do within the medical field. They're great partners with doctors, nurses, etc. And I think this will be a great opportunity to have a healthier Pennsylvania moving forward. With that, I guess, Deputy Secretary, you're up, and thank you so much for coming out today.
Good morning. I'm really excited to bring you all greetings on behalf of our Governor, Governor Wolf, and our Secretary of Health, Secretary Murphy. And I'm really excited about what this means for the health of the children of the Commonwealth. As a pediatrician, I know too well what it's like for my patients to be backed up in clinic. And it's really frustrating as a parent when you're just there to get your flu shot. I'm really also excited as a physician that we can really collaborate and work with pharmacists to offer our children of our state a really good opportunity to be healthy and to be the best students they can be as they prepare to go back to school. So once again, to Rite-Aid and to the pharmacies of the state and the pharmacists of the state, we're really excited to partner with you and are excited to see all the good things that are coming from this bill and this law. Thank you.
I first would like to extend a very sincere thank you on behalf of the Pennsylvania Pharmacists Association to Representative Grove and Senator McGargle for working side by side with community pharmacists to help us achieve this important milestone in expanding pharmacists' role in providing the flu vaccine to children. Without their commitment and passion to advancing the pharmacy profession, we would not be here today. We also thank Representative Delozier, Harhart, and countless other members of the General Assembly for their advocacy on Act 8 of 2015 and for their continued support of pharmacy. Our message to you today stresses the important role pharmacists, especially those in the community, play in patient care, and why pharmacists are uniquely positioned to safely promote, provide, and increase the flu vaccine, as well as all vaccines among children, adolescents, and adults. There are many reasons why preserving community pharmacy and the access to medication expertise provided through your local pharmacist is necessary and a vital part of our healthcare system. With the role of pharmacists continuing to expand and fill in gaps in primary care where it makes sense, you can rest assured that pharmacists will continue to provide you with high quality, personalized care, and medication services that you and your family members deserve. Pharmacists can and do make a difference in patients' lives. I now invite members of the media to Rite-Aid's consultation room for a photo opportunity with the child who will be receiving her flu shot. Thank you.